If you're over 60 and taking any prescription medication right now, what I'm about to share could explain why you've been walking into rooms and forgetting why you're there, or why names that used to come easily now slip away like water through your fingers. The medication sitting in your bathroom cabinet, prescribed by a doctor you trust, might be silently stealing your memories, and you have absolutely no idea it's happening. I'm Dr. Michael Turner, and I've been practicing internal medicine for over 20 years, specializing in geriatric care. Throughout my career, I've seen hundreds of patients who came to me terrified they were developing dementia, only to discover that common medications were the real culprits behind their cognitive decline. What's particularly concerning is that many of these drugs are considered so safe that doctors prescribe them without a second thought, yet their impact on brain function, especially in older adults, can be devastating. Before we dive deeper into this critical topic, if you haven't subscribed yet, I strongly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed especially for you. If you find this video helpful, please leave your questions and video suggestions in the comments below. I read every single one, and it helps me create more content to help people just like you. Now, let me be absolutely clear from the start. I'm not telling you to stop taking any medication. Never, ever stop a prescribed medication without consulting your doctor first. What I want to do today is educate you about potential risks so you can have informed conversations with your healthcare provider. Knowledge is power, and understanding how your medications affect your brain is the first step toward protecting your cognitive health. Let me tell you about Dona Maria Helena, a 72-year-old retired teacher from Porto Alegre. Maria Helena had spent 40 years teaching mathematics, known for her sharp mind and ability to remember every student's name, even decades after they graduated. She lived alone in a modest apartment, proud of her independence, still doing her own grocery shopping, managing her finances, and volunteering at the local library 3 times a week. But over 6 months, everything changed. She started missing appointments she'd never forgotten before. She'd go to the market with a list and come home with completely different items. Most frighteningly, she got lost walking home from the library one afternoon, a route she'd walked for 15 years. Her daughter Anna became deeply worried and brought her to see me, convinced her mother was developing Alzheimer's disease. Maria Helena sat in my office with tears streaming down her face, telling me, "Doctor, I feel like I'm losing myself. I taught mathematics for 4 decades, and yesterday I couldn't remember how to calculate a tip at a restaurant." I'm terrified. As we reviewed her medical history and medications, I discovered she'd been prescribed a common antihistamine for seasonal allergies about 8 months earlier. That medication belonged to a class of drugs with what we call anticholinergic properties, and they were likely responsible for her cognitive decline. You see, our brains rely on chemical messengers called neurotransmitters to function properly. One of the most important for memory and learning is acetylcholine. Anticholinergic medications block this neurotransmitter, and while younger brains can often compensate for this interference, aging brains are much more vulnerable. The effect is like trying to make a phone call with a weak signal. The message is there, but it can't get through clearly. In Maria Helena's case, we worked with her allergist to switch to a non-sedating, non-anticholinergic alternative. Within 3 weeks, she started feeling sharper. Within 2 months, she was back to her normal self, volunteering at the library again and managing her life independently. But those months of fear and confusion took an emotional toll on both her and her family that could have been avoided with better awareness. The first category of medications I need you to understand are these anticholinergic drugs I just mentioned. They're everywhere in medicine, and chances are you or someone you love is taking at least one. We're talking about certain antihistamines, medications for overactive bladder, some antidepressants, drugs for vertigo and motion sickness, certain muscle relaxants, and even some medications for Parkinson's disease. The challenge is that these drugs don't just block acetylcholine in one part of your body. They affect your entire system, including your brain. What makes this particularly insidious is that the cognitive effects are often subtle at first. You might attribute them to normal aging or stress. Maybe you forget where you put your keys more often. Perhaps you struggle to find the right word in conversation. You might have trouble concentrating when reading or following complex conversations. These seem like minor inconveniences until they accumulate and suddenly you realize your memory isn't what it used to be. Research has shown that long-term use of strong anticholinergic medications is associated with an increased risk of dementia, and the effect appears to be dose-dependent and cumulative. The more anticholinergic drugs you take and the longer you take them, the greater your risk. If you're still watching and finding this information valuable, please comment below to let me know you're following along. Your engagement helps me understand what content matters most to you. Let me introduce you to Senor João Carlos, an 80-year-old retired mechanic from Curitiba. João Carlos was the kind of man who could fix anything. His garage was his sanctuary, filled with tools he'd collected over a lifetime, each one with its own story. Even in his late 70s, neighbors would bring him broken appliances, and he'd have them working like new within hours. His memory for mechanical systems was extraordinary. He could visualize how engines fit together, remember specifications for parts, and troubleshoot problems that stumped younger mechanics. 3 years ago, Juan Carlos had trouble sleeping. Like many older adults, he found himself waking multiple times during the night, struggling to fall back asleep. His doctor prescribed a benzodiazepine, a medication designed to help with sleep and anxiety. Initially, it worked wonderfully. He slept through the night for the first time in years, but gradually, his family started noticing changes. He became more forgetful. He'd start projects in his garage and abandon them, unable to remember what he was working on. His grandson brought him a radio to fix, something that would have taken him 20 minutes in the past, but Juan Carlos stared at it confused, unable to figure out where to begin. His wife, Donna Carmen, noticed he seemed foggy during the day, moving more slowly, responding to questions with delays. When she expressed concern, Juan Carlos dismissed it, saying he was just getting old. But one morning, Donna Carmen found him in the garage, sitting on his workbench, crying. "I don't know how to fix things anymore," he told her. "Everything I knew is just gone." That's when they came to see me. Benzodiazepines are the second category of medications that can significantly impact memory and cognitive function, especially in older adults. These drugs, often prescribed for anxiety, insomnia, or muscle spasms, work by enhancing a neurotransmitter called GABA, which has a calming effect on the brain. While they can be effective for short-term use, long-term use in older adults is problematic for several reasons. First, they can cause what we call anterograde amnesia, which means difficulty forming new memories while under the drug's influence. You might have a conversation and have no memory of it hours later. You might be told important information and completely forget it was ever shared. Second, benzodiazepines accumulate in the body over time, especially in older adults whose liver and kidney function naturally decline with age. What starts as an appropriate dose can become too much as the medication builds up in your system. This leads to increased sedation, confusion, balance problems, and cognitive impairment. Third, these medications can actually worsen sleep quality over time, even though they help you fall asleep initially. They reduce the amount of deep, restorative sleep and REM sleep your brain needs to consolidate memories and clear out toxins. It creates a vicious cycle where you feel you need the medication to sleep, but the medication itself is preventing you from getting truly restful, cognitively beneficial sleep. In Juan Carlos's case, we carefully tapered his benzodiazepine under close medical supervision. I cannot stress enough that stopping these medications abruptly can be dangerous and even life-threatening. They must be reduced gradually under medical guidance. We also worked on sleep hygiene, cognitive behavioral therapy for insomnia, and addressed some underlying sleep issues that had been masked by the medication. The process took several months, but gradually, Juan Carlos's mental clarity returned. 6 months after completely discontinuing the benzodiazepine, he was back in his garage, fixing things again, his mind sharp as ever. His grandson said it was like having his grandfather back. But here's something that might surprise you even more. The third category of medications that can affect your memory are drugs you might not suspect at all, certain blood pressure medications. Now, I'm not talking about all blood pressure medications. In fact, some research suggests certain types might actually protect cognitive function. But there are specific classes that can cause problems, particularly beta blockers that cross into the brain and certain calcium channel blockers. Let me tell you about Donna Teresa, a 68-year-old former accountant from Florianopolis. Teresa had always been meticulous with numbers, organized to a fault, with a calendar system that kept her life running smoothly. She managed her condominium's finances, coordinated family gatherings for her large, extended family, and never missed a bill payment or doctor's appointment. When she was diagnosed with high blood pressure, her doctor prescribed a beta blocker. The medication effectively controlled her blood pressure, but within months, Teresa started experiencing what she described as mental fog. She'd sit down to balance the condominium accounts, something she'd done effortlessly for years, and find herself staring at numbers that made no sense. She missed her own granddaughter's birthday party, something that would have been unthinkable before. At the supermarket, she'd stand in the aisle unable to remember what she came to buy, even with a list in her hand. Her husband, Senor Augusto, grew concerned when she broke down crying one evening, saying, "I feel like my brain is wrapped in cotton. Everything is distant and unclear." Beta blockers work by blocking the effects of adrenaline and similar stress hormones. While this is excellent for lowering blood pressure and reducing strain on the heart, these hormones also play a role in memory formation and cognitive alertness. When you block them, especially with medications that cross the blood-brain barrier, you can experience reduced mental clarity, difficulty concentrating, and memory problems. Some people also report vivid, disturbing dreams that disrupt sleep quality, further compounding cognitive issues. Additionally, by lowering blood pressure, these medications sometimes reduce blood flow to the brain below optimal levels, especially in people who already have compromised circulation. Your brain is incredibly energy hungry, requiring about 20% of your body's blood supply despite being only 2% of your body weight. When blood flow is reduced, even slightly, cognitive function can suffer. This doesn't mean beta blockers are bad medications. For many people, they're life-saving. But it does mean that if you're experiencing cognitive changes after starting one, it's worth discussing alternatives with your doctor. In Teresa's case, we switched her to a different class of blood pressure medication that didn't cross the blood-brain barrier as readily. Within weeks, she reported feeling like herself again. The mental fog lifted, her memory improved, and she was back to managing her responsibilities with her characteristic precision. She told me, "It's like someone turned the lights back on in my brain." If this information is resonating with you, or if you've experienced something similar, please share in the comments. Your story might help someone else recognize what's happening to them. The fourth category of medications I need to discuss are certain pain medications, particularly opioids. Now, I understand that chronic pain is a serious issue, and for some people, opioid medications are necessary for quality of life. I'm not here to judge anyone's pain management needs, but it's important to understand how these medications affect cognitive function, especially with long-term use. Senor Roberto, a 74-year-old retired construction worker from Belo Horizonte, came to me with a complicated situation. Roberto had worked with his hands his entire life, building homes across his city, proud of every structure he'd helped create, but decades of physical labor had taken their toll on his body. Severe arthritis in his spine and knees caused constant pain that made even simple tasks difficult. His doctor prescribed opioid pain medication, and it gave him relief he hadn't felt in years. He could finally sleep through the night, walk to the corner cafe with his friends, play with his great-grandchildren. But his daughter Lucia noticed troubling changes. Roberto would repeat the same stories multiple times in a single conversation, not remembering he'd just told them. He'd forget to take his other medications or take them twice, unable to remember if he'd already taken his morning pills. His personality seemed different, too. More withdrawn, less engaged with family conversations, almost like he was present physically but absent mentally. Lucia described it as talking to a softer version of my father, like the volume on his personality had been turned down. Opioids affect the brain in multiple ways that can impair cognition. They bind to receptors throughout the nervous system, including areas crucial for attention, memory, and information processing. They alter levels of neurotransmitters important for cognitive function. They can cause what's called cognitive slowing, where you can still think and remember, but everything takes longer and requires more effort. It's exhausting, and over time, many people simply disengage from mentally demanding activities, which further accelerates cognitive decline. Long-term opioid use can also disrupt sleep architecture, reducing the amount of deep sleep during which your brain consolidates memories and clears out metabolic waste products. Additionally, these medications can cause hormonal changes that affect brain health, including reduced testosterone levels in men, which has been linked to cognitive decline. The sedative effects can accumulate, especially in older adults with slower metabolism, leading to persistent drowsiness and confusion. In Roberto's situation, we worked closely with a pain management specialist to develop a comprehensive approach. We reduced his opioid dose gradually while introducing other pain management strategies. Physical therapy specifically designed for older adults, targeted injections for his worst arthritis areas, non-opioid pain medications, and even cognitive behavioral techniques for pain management. It wasn't a quick fix. Pain management is complex, and what works varies tremendously between individuals, but over time, we found a balance where his pain was manageable without the high doses of opioids that were affecting his cognitive function. Lucia told me months later, "I have my father back." He's himself again, participating in conversations, remembering things, making jokes like he used to. Now, the fifth category might surprise you because these are medications that many people take daily without a second thought. Proton pump inhibitors, or PPIs, commonly used for acid reflux and heartburn. Medications with names ending in prazole fall into this category. They're among the most commonly prescribed medications worldwide, and many people take them long-term, sometimes for years or even decades. Let me share the story of Dona Patricia, a 65-year-old retired nurse from Salvador. Patricia knew medicine from the inside, having spent 40 years caring for patients. When she developed severe acid reflux, she started taking a PPI, and it worked wonderfully. No more burning, no more discomfort, no more waking up at night with acid in her throat. She could eat the foods she loved again. She was so satisfied with the results that she continued taking it year after year, assuming something that worked so well and seemed so safe must be fine for long-term use. But about 3 years into taking the medication, Patricia started noticing changes that frightened her. She'd go to the pharmacy where she'd worked for decades and couldn't remember where common medications were located. She'd struggle to recall the names of conditions she'd dealt with for her entire career. During family gatherings, she'd lose track of conversations, feeling like her mind was always one step behind everyone else. As a healthcare professional, she was terrified she was developing early-onset dementia. She'd seen it in colleagues before, and the thought paralyzed her with fear. The connection between PPIs and cognitive function is more complex and still being researched, but there are several mechanisms of concern. First, PPIs can interfere with vitamin B12 absorption. Your stomach acid is necessary to separate B12 from the proteins in food, and when you drastically reduce stomach acid, B12 absorption decreases. B12 deficiency causes neurological problems, including memory issues, confusion, and cognitive decline. Second, some research suggests PPIs might increase levels of beta amyloid proteins in the brain, the same proteins that accumulate in Alzheimer's disease. The evidence is still emerging, but it's concerning enough to warrant attention. Third, by reducing stomach acid, PPIs can affect the absorption of other nutrients important for brain health, including magnesium, calcium, and possibly iron. Fourth, PPIs can alter the gut microbiome, the community of bacteria in your digestive system, and we're increasingly learning how the gut microbiome influences brain function through what's called the gut-brain axis. Changes in gut bacteria composition have been linked to cognitive changes and even mood disorders. In Patricia's case, we investigated whether she still needed the PPI at all. Many people start these medications for a specific issue, but the underlying problem resolves or changes, yet they continue taking the medication indefinitely. We discovered that lifestyle modifications, dietary changes, and timing of meals could manage her reflux without medication. We gradually reduced and then stopped the PPI while monitoring her symptoms carefully. We also checked her B12 levels and found them low, so we supplemented. Within months, Patricia reported feeling mentally sharper. She described it as the fog lifting. Her memory improved, her mental quickness returned, and she felt like herself again. Now, if you're watching this and realizing you're taking one or more of these medications, please don't panic. Remember, these are not bad medications. They save lives, improve quality of life, and are absolutely necessary for many people. The issue is awareness and informed decision-making. You need to know the potential cognitive side effects so you can monitor for them and have conversations with your doctor about whether alternatives might work equally well with fewer cognitive impacts. Here's what I want you to understand. Medication-induced cognitive impairment is often reversible. This is fundamentally different from dementia or Alzheimer's disease. When the offending medication is reduced or discontinued under proper medical supervision, cognitive function typically improves, often dramatically. But here's the heartbreaking part. Many people don't realize their medications are the problem. They assume they're developing dementia, they lose hope, they become depressed, they stop engaging in activities that keep their minds sharp, and this creates a downward spiral that becomes increasingly difficult to reverse. I've seen patients and families go through unnecessary anguish, making difficult decisions about long-term care, giving up independence, all because no one considered that medications might be the culprit. I've watched people say goodbye to hobbies they loved, stop managing their own finances, withdraw from social connections, convinced their cognitive decline was inevitable and irreversible, when in reality, adjusting their medications could have restored their mental clarity. But wait, there's something else you need to know that makes this even more concerning. Many older adults aren't taking just one of these medications. They're taking multiple medications that can affect cognition, and the effects can multiply. It's called polypharmacy, and it's incredibly common in people over 65. Studies show that the average person over 65 takes 5 or more prescription medications regularly. When you combine medications with anticholinergic properties, add a benzodiazepine for sleep, throw in an opioid for pain, and maybe a PPI for reflux, you've created a perfect storm for cognitive impairment. Each medication individually might cause subtle effects you could compensate for, but together, they overwhelm your brain's ability to function normally. And here's what makes it particularly tricky. These effects can develop gradually over months or years. You don't wake up one day suddenly confused. Instead, it's a slow slide that's easy to attribute to normal aging until it reaches a point where it can no longer be ignored. Let me tell you about Senor Marcos, an 83-year-old retired engineer from Recife. Marcos came to me not by his own choice, but because his son, Paulo, practically dragged him to my office. Marcos had been living independently, managing just fine, or so he thought. But Paulo had noticed alarming changes during his weekly visits. His father's apartment, once impeccably organized, was cluttered and messy. Bills were piling up unpaid. The refrigerator contained spoiled food. Marco seemed confused about what day it was, what he'd eaten, whether he'd taken his medications. When I reviewed Marcos's medication list, I was stunned. He was taking 14 different medications prescribed by 4 different specialists, who apparently weren't communicating with each other. Among them were 2 medications with strong anticholinergic effects, a benzodiazepine he'd been taking for 15 years, an opioid for chronic back pain, and a PPI. Each doctor had prescribed what they thought he needed for their specific condition, but no one was looking at the big picture of how all these medications interacted and affected his brain. We conducted a comprehensive medication review, a process I wish happened more often in healthcare. We contacted all his specialists, reviewed what was truly necessary versus what was habit or outdated. We discovered that several medications could be discontinued entirely. Others could be reduced in dose. Some could be switched to alternatives with fewer cognitive effects. The process took several months of careful adjustments, close monitoring, and patience. The transformation was remarkable. Gradually, Marcos became more alert, more engaged, more like his former self. His apartment became organized again. He started managing his finances. He began cooking meals again, something he'd loved but had stopped doing. Paulo told me with tears in his eyes, "I thought I was losing my father to dementia. I was preparing myself to put him in a nursing home. But he was just over-medicated. We got him back." So what should you do with this information? First, never stop or change any medication without consulting your doctor. I cannot emphasize this enough. Some medications, particularly benzodiazepines and opioids, can cause serious withdrawal symptoms if stopped abruptly. Changes need to be made carefully and under medical supervision. Second, if you're experiencing memory problems, confusion, or cognitive changes, and you're taking any of the medications I've discussed today, schedule an appointment with your doctor, specifically to review your medications. Don't just mention it in passing during a visit about something else. Make it the focus of the appointment. Bring a list of all your medications, including over-the-counter drugs and supplements. Be honest about your symptoms and how they're affecting your life. Third, ask your doctor these important questions. Is this medication still necessary, or was it prescribed for a condition that has changed or resolved? Are there alternatives with fewer cognitive side effects? Could the dose be reduced? What are the risks and benefits of continuing versus discontinuing or changing this medication? Don't be afraid to advocate for yourself. You know your body and mind better than anyone else. Fourth, keep track of when you started medications and whether you noticed any cognitive changes around that time. Sometimes patterns only become clear when you look back at the timeline. A medication journal can be incredibly helpful. Note when you start or stop medications, when doses change, and any changes in how you feel physically and mentally. Fifth, if you have multiple doctors prescribing medications, make sure they're all aware of what the others have prescribed. Bring a complete medication list to every appointment. Consider having one primary care doctor who oversees all your medications and coordinates with specialists. This kind of comprehensive medication management can prevent the dangerous accumulation of drugs that happened to Marcos. Sixth, be proactive about your cognitive health beyond just medications. Engage in activities that challenge your brain. Stay socially connected. Exercise regularly, which is one of the best things you can do for brain health. Get quality sleep. Eat a diet rich in fruits, vegetables, whole grains, and healthy fats. Manage stress. Control conditions like diabetes, high blood pressure, and high cholesterol, which affect brain health. Your brain is remarkably resilient and capable of recovery when given the right support. Seventh, if you have elderly parents or relatives, pay attention to changes in their cognitive function, especially if they've recently started new medications or if multiple medications have accumulated over time. Sometimes family members notice changes before the person experiencing them does. Approach these conversations with love and concern, not accusation. Offer to accompany them to doctor appointments to help advocate for appropriate medication reviews. Finally, remember that aging does not have to mean cognitive decline. While some changes in processing speed and memory are normal parts of aging, significant confusion, severe memory loss, inability to manage daily activities, these are not normal aging. They're signs that something is wrong and needs investigation. Don't accept that it's just getting old. Demand answers. Push for thorough evaluation. Many causes of cognitive decline, including medication effects, are reversible if caught and addressed. The patients I've shared with you today, Maria Helena, João Carlos, Teresa, Roberto, Patricia, and Marcos, they're composite examples based on real patients I've seen throughout my career. Their stories represent hundreds of others I could tell. Each one thought they were losing their minds, developing dementia, facing an irreversible decline. Each one discovered that medications were stealing their memories, clouding their thoughts, diminishing their lives, and each one recovered when the problem was identified and properly addressed. I want you to leave here today with hope, not fear. Hope that cognitive changes might be reversible. Hope that asking questions and advocating for yourself can make a difference. Hope that growing older doesn't have to mean accepting mental decline. But I also want you to leave with knowledge and awareness. Knowledge that common medications can affect your brain in profound ways. Awareness that symptoms you might attribute to aging could have a fixable cause. If you found this video helpful, please share it with friends and family who might benefit. Leave a comment below telling me about your experiences or questions. Your engagement helps this channel reach more people who need this information. And remember, always consult with your healthcare provider before making any changes to your medications. What I've provided here is education and awareness, not personal medical advice. Take care of your brain. It's the only one you have, and it deserves your attention and protection. Thank you for watching, and I'll see you in the next video where we'll continue exploring ways to maintain your health and vitality as you age.